Excellent. This is a webinar on setting nutritional goals for your cancer treatment and recovery, and we have an expert in our midst that is going to be speaking on this topic. This is for breast cancer patients, survivors, caregivers, family, and loved ones. Anyone and everyone should be a part of this webinar. And so right now, I'll be welcoming everyone on the call. We would love to know who is on the call. So please do put in the chat, tell us your name and where you're joining in from. Are you from Abuja? Are you from Kaduna? Are you from Sokoto? I would really love to meet her. So in the next 1 minute, please tell us where you're joining in from. As we love to meet everyone here on the call. Yes, we're waiting for more responses from us. Okay, I see Chioma joining in from Lagos. I see Elizabeth from Lagos. Wow, I see we have Lagos people on the call. I would love to get more responses from others on the call. Where are you joining in from? It's a pleasure to meet us. If you're just joining in, we're in the welcome and opening remarks, and it's a great pleasure that it's great to know that you are able to make this webinar to meet us on this call. And so, on that note, I would love us to just put in the chat where we're joining it from. Okay, I see we have Mrs. Martins from Ekiti State University Teaching Hospital. Welcome, ma. We have Ibe Chineye from Lagos. Welcome, ma. We have Taiwo from Lagos. Beautiful. Thank you so much for responding. We'll now move on to the next thing on, which is the icebreaker. And so on this part, I'm going to now hand over to my colleague Elizabeth to take us on the icebreaker.
Good evening, everyone. Welcome, everybody. Thank you for making time to attend today's webinar. So today's icebreaker's question is just to lighten the room, and I would like you to provide your answers in the chat. What is one thing you are hoping to learn or achieve through nutrition during your cancer treatment or recovery journey? From this webinar today, what are you hoping to learn? Maybe an habit you are trying to change through your cancer treatment or recovery journey. Please provide your answers in the chat. Thank you. I'm waiting for our responses. What is one thing you are hoping to learn or achieve through nutrition during your cancer treatment? Okay. Okay, thank you, Mrs. Chioma. You said how to manage weight gain while on hormone therapy, tamoxifen. Thank you very much. Mm. Any other expectation from today's webinar? We have an answer here, how to manage weight gain. Any other expectation? Okay, I have 1 minute left before we move to the next agenda. Okay, thank you very much. I'll hand over to Modupe now.
Thank you very much, Elizabeth, for that. And thank you to those who dropped comments in the chat. It's so great to see our expectation. And with that, we'll move on to introducing our speaker. And today, this afternoon, we have with us dietitian Charles Oguigbe, a specialist dietitian. He is a registered dietitian nutritionist with over 10 years of experience in clinical and community nutrition. He is registered with the Health and Care Professions Council, HCPC, and is also a member of the Dietitians Association of Nigeria, DAN, serving as the Public Relations Officer for the Lagos State chapter. He focuses on using evidence-based nutrition to improve the lives of his patients, especially those with cancer, and advocates for public nutrition awareness. He's also a mentor dedicated to making nutrition science practical and accessible. Please join me in welcoming dietitian Charles Ogripe. Over to you.
Good evening, everyone. Thank you so much, Modube. I feel very honored. And thank you, everyone who is on this call. I know people are really in the Xmas mood, holiday mood, but finding out time to be on this call is something we really appreciate. I hope I will be able to provide the answers that people really hope for. Thank you so much, Modube. So today real quick, we'll be talking about something very interesting. I mean, a topic that is very, very interesting. It could be very overwhelming also for a lot of persons, especially patients. I understand that we have caregivers on this call, we have patients, and then we have healthcare professionals who also uh, see cancer patients, are also involved in the management of cancer. So today's topic is really interesting because uh, when people hear the word cancer, there's a lot of stories that comes with it. I'm sure anyone who is a patient here can relate. There's a lot of myth. There's a lot of don't do this, do that, and the rest of them. I mean, it messes a lot of people's head and they are very confused. So what we tend to achieve today is to provide those specific goals, nutritional goals that will help you tailor it down, make it very easy, make it simple, and then you achieve your nutritional goals at the end of the day. That's what we want to do. So, while I am still here, I will want someone on this call tell me one thing you have heard about nutrition in the management of cancer. I don't want to help anyone, but I know in my in the clinics where I counsel patients and during the consultation, there's a lot of things they tell me. So on the chat, please quickly, I want us to be active. I want us to also engage. Tell me what you think or what you've heard about nutrition in the management of cancer. Maybe those food you've been asked not to eat, the rest of them. I'm just waiting for one answer and then we move on. Anyone on the chat? What have you heard? What have you been told not to eat? What have you been told to eat? And the rest of them. Just one answer and we'll move on. Anyone? Okay. So while we're waiting for that, next slide. Everybody there? Okay, great. So while we are waiting, oh, great. I have something. Someone said, I've heard that liquid diets are best and not take oranges during radiotherapy. Fantastic. That is one of the things people hear and a whole lot. Okay, another one. They shouldn't eat sugar. Fantastic answers. We'll talk about these things honestly because these are the things that really makes feeding hard doing management, treatment of cancer, and even when you're done treating, people are still confused on what to feed on and not. Okay, someone said I should not eat semo eba and the rest of them also not taking tea. Great. So we'll get answers to all of these during this section. Thank you so much for participating. I really appreciate that. So why does nutrition matter at all? Why do we talk about nutrition when we are talking about treatment of cancer? Shouldn't the just be chemotherapy, radiotherapy, surgery, and the rest of them. Why is nutrition important? Now, this is one thing I tell every patient that I meet. The bedrock of healthy living is nutrition. I'm not saying this because I'm a dietitian. I'm sure anyone who understands fully what healthy living is, you will know that nutrition plays a major role. So it is the bedrock of healthy living. There is no one person on this call who doesn't eat. If there's anybody on the call that doesn't eat at all, please, you can just notify us and tell us why. So everybody eats. I heard that fast food should be avoided. Absolutely. So everybody eats for one main purpose, just to feed the body. It's amazing how our body is made, the structure of our body, the makeup of our body. The body is made in a way that it can heal itself, it can restore itself, okay? And it can grow itself. One thing the body requires from every human being is just food. Food. I mean, I'm sure everyone in this call can relate when you have a cut and maybe you didn't apply anything on it and you find out that at the end of the day, the cut goes away because the body has the ability to heal itself. Now, it's very unfortunate that as human beings, we have to feed. We have to put on clothes, we have to rub some things, cosmetics, and a whole lot of things which have become detrimental to our body. And when that happens, it affects the body's ability to function well. It affects the organs of the body, it affects the cells, it affects the tissues, and every other makeup that has made our body our body. Now, nutrition is important for every human being because it is what nourishes us, it is what heals us. The kind of food you eat can heal you from certain diseases. But this is not me saying that nutrition alone can heal cancer or can fight cancer or can destroy cancer. What I'm saying is that while we are going through treatment of cancer, we can never, the word is never, ignore nutrition. Ignore what you feed on because it is what will determine how fast you are able to heal. It is what will determine if if you're going to heal at all. So for particularly cancer patients, one of the major things nutrition will do for you is that nutrition will support your immune system, it will support your immune function and healing. The truth is, while I see patients, I counsel them that it's also very important that you are healthy before you go into treatment. Chemotherapy, for example, have a lot of side effects. Yet it is also good in treatment of cancer because it's targeted at either shrinking or killing those cancer cells. However, if your immune system is very low, you are not healthy and you go into treatment, it's going to affect you in so many ways as against someone who was healthy before going into treatment. So nutrition supports your immune system, makes it strong to withstand the pressure that comes from the treatment method you've chosen, be it radiotherapy, chemotherapy, and the rest of them. So nutrition plays a major role. And there are specific vitamins and minerals or nutrients, I would say, that play these major roles. Number one, we can't do without is vitamin C, very strong. I'm sure we can all relate. When people are having sneeze, cough, and the rest of them, would want to tell you, take vitamin C and the rest. What it does is that vitamin C helps in so many ways. What it does is that it neutralizes the free radicals and reduces oxidative stress. Free radicals are the things that causes sickness, that makes us sick. So vitamin C, perfect. Vitamin A, the same thing. Vitamin A helps in cell differentiation. It helps those cells not to continue to grow fast. You know, when there is a cancerous cell, I mean, we have this belief that if not treated, it grows rapidly and it grows very fast. So some of these nutrients will slow that down and also help you recover. Vitamin D, very perfect in reducing inflammation. When anybody is sick, particularly someone who has cancer, there'll be a lot of inflammation going on in your body. So vitamin D and zinc helps in reducing those inflammation, and zinc particularly helps to defend the immune system from destroying totally. More still, while you're going through treatment, it's important you understand that that treatment method, while they are trying to kill the cancerous cell, is someone saying something? Can I go ahead, please?
Yes, you can. Please go ahead.
Okay, thank you so much. So, while you are treating cancer, you have to understand also that the target is to shrink or to kill those cancerous cells. But while doing that also, the treatment method will affect the healthy cells, thereby making you sick. It's also important that you feed well at those times so that those healthy cells also will regenerate and grow on its own. Another thing nutrition does, it helps in the management of side effects. For some of us who are patients and you're on this call, probably you must have started your treatment, choosing chemo or radio. You will agree with me that there are certain side effects that happens while you're being treated. A lot of them. Examples, fatigue, nausea, weight loss, constipation, diarrhea, and a whole lot of them. Now, how does nutrition come in? This is one aspect of my counseling sessions that I take very seriously as well. Because I need to put you on the known that look, once you start treatment, expect that these things will happen to you. But what is important is why these things happens to you, what do you do? Why the nurses and doctors are taking care of the medications and all of that, you need to also support with nutrition. Let's take, for example, someone who is, having unintentional weight loss, because that would happen once cancer sets in. Uh, when I'm managing cancer patients, I don't really talk much about weight loss for them, trying to lose weight, because I know that the cancer itself is demanding so much from the body and the metabolic rate is high. So the person is bound to lose weight, knowingly or unknowingly. So the weight continues to drop because of the high demand of the cancer and what we call cancer cachexia that happens. The person will begin to lose muscles, the person will begin to lose the fat. So that's why you see cancer patients lose weight. That's number one. Number two, because of the pains they are going through, a lot of them begin to lose appetite. And when you don't eat, you begin to lose weight. So loss of appetite is one of the things that happens to every cancer patient. Maybe because you are confused on what to eat, or maybe because you are worried about what is going on. There's what we call anorexia nervosa. This is what we call emotional eating. It happens to people a lot. In fact, not even just cancer patients. Once you're sick, you are more focused on getting well. You're more focused on the pains you're going through. So everything might seem irritating to you. Nausea sets in. You perceive anything you want to vomit, right? So, but why this is happening, you are losing nutrients or you're not taking enough nutrients and you're losing weight. So the weight loss happens. What nutrition does for you here is that we will teach you how to deal with weight loss. What you need to do is very simple. We are dealing with weight loss. First off is start with the food you like. Start with the simple food you can take in. When there is nausea, you're not smelling anything. What are the simple food? Pap. Pap is the most common thing I recommend for anyone who do not have appetite to feed. You start with pap, you can do smoothies, you can do pepper soup, you can start with the very small, small food you will eat, joyfully. Please go back there. Let me just round up. Great. So I don't want to dwell much here. I think my time is being monitored. So nutrition also maintains strength, energy, and it's important that you know that without energy, without strength, as a cancer patient, you cannot even stand up. You can't walk. You can't do anything. It's important that you eat food that contains a lot of carbohydrates and healthy fats. We can't do without carbohydrates. So I know someone said, don't eat carb, don't do that. No, You cannot, no human being can do without carbs. I needed to make that point. Then, nutrition also improves quality of life and recovery outcome. Next slide, please. So, the main thing we want to do today is to set those nutritional goals. I mean, there's a lot that could be said about nutrition and cancer, but we want to set specific goals, key areas that matters to us in the management and in the treatment of cancer. Number one is weight and muscle mass. Weight loss happens. That was what I was talking about in the other slide. Weight loss happens unintentionally. You didn't want to lose weight, but it happens for the two reasons I mentioned. It's either you lost your appetite or the cancer is demanding a lot from you. You're losing muscle mass, you're losing fat, weight loss happens. So we're going to set goals that will help us deal with weight loss and muscle mass. Then, secondly, is about managing symptoms. Actually, it was side effects, constipation, appetite loss, and the rest of them. These are the things we are going to focus on how to manage those symptoms. One might ask me if I'm having constipation, what do I do, and the rest of them. And then supporting immune system, I've talked about that, and preventing malnutrition. I mean, so this is a path that people do not really take note of. When you're sick, because of the two things I've mentioned earlier, because of the loss of appetite and because of the cancer cachexia, you will tend to be malnourished over time because you're not eating enough or you're not eating the right kind of food. So we're going to be talking about personalized dietary targets to support health after treatment. Next slide, please. Great. So this is it. So I want someone, please go back. I want someone to just type on the chat boss, if you're listening. Uh, when you hear the word smart, what does it mean to you? Anyone? I'll just wait for you guys, then I'll jump in. Smart, the five-letter word, SMART. Smart. What does smart mean to you? Mm. Smart. I want to be sure people are listening, people are on this call. Smart. What does it mean to you? Next slide. Beautiful. So what we are going to be doing today, good. Someone says specific, measurable, achievable. Thank you, Elizabeth. That was smart also. Okay, so what we're going to do today is to set those smart nutritional goals that will help you. Like I said, a lot could be heard about cancer. A lot could be said about cancer. There is internet, people browse things. Someone says specific, measurable, achievable, time board. Perfect, perfect. Thank you, Aliyu. That was smart also. So what we are doing is to set these specific goals and then follow them through. You will see that you will not be confused at all. Why counseling patients at the clinic? A lot of them will tell me, so look, dietitian, I heard I shouldn't eat bread. I shouldn't eat this. I shouldn't. What then will I eat? I am really confused. I'm tired. This is overwhelming for me. They said I shouldn't eat. I should eat only grass. I should eat only fruits. Is that true? So to deal with that kind of question, what you need to do is to set smart nutritional goals. SMART, S stands for specific. M stands for measurable, achievable, realistic, time-bound. These are very simple things. Specific means eat 5 servings of fruits and vegetables daily. It's very simple. I'm sure anyone can do this. So what you do is you go into the market, ensure buy some fruits and vegetables, keep in your kitchen or your basket or whatever. Ensure that you eat fruit every day. It's that simple. I'm sure it's not hard. Every day. So that way you're getting enough vitamins and nutrients that will help support your body for the treatment. Oh, someone said something. Pure Navigator, Yobe States. Oh, okay. Someone dropped. I mean, Modupe, I'm sure you take care of that. Someone dropped the number and the rest. Okay. That measurable. You need to also measure and track, not just eating. It's important that you measure what you eat during cancer treatment. You can't just eat out of the box. That is why it's important that you also meet your dietitian who will give you a personalized meal plan. So what this meal plan is going to do is going to tell you the specific food you are meant to eat, the time of eating those food, the quantity or the amount of the food you are going to eat. So in that meal plan, all of those food are being calculated. The amount of nutrients in those food are calculated, macronutrients, micronutrients, all calculated. So it's important we measure your food. Achievable based on current appetite and energy. This is very important. So when we have patients who do not have appetite, like I said, you can start with bland food and you start eating, and over time you see that your appetite will increase. I said 2 days ago, I was chatting with a patient in my workplace, and she said to me, "Look, dietitian, the quantity of food you prescribed for my mother, it's small. She's these days she's getting hungry. Her appetite is increasing." So first thing I told her was this was a good news. This is actually a good news for me. So what it means is that I'm going to adjust the calorie intake of your mother because her appetite have increased. That's what we want every cancer patient to do. We want their appetite to increase because naturally it will decrease, thereby affecting your nutrition, then affecting your treatment outcome. Then realistic. Don't do things because you saw on the internet people are doing this kind of things and the rest of them. I get that a lot. People call me to say, "Oh, Lachian, can I do this? I saw it on the internet. Is this something I can do?" The truth is about nutrition, it is personalized. You don't do what every other person is doing because you need to first understand your body, understand what you're going through and what you can take. So tailor your food towards your treatment side effect. For example, someone is having constipation. They can't go to the toilet, they can't poo, and the rest. What do you do? At that point, you increase your fiber intake. Very simple, buy a lot of fruits and then eat, and then it pushes out the poo. It's that simple. So you have to be realistic about the side effects. You have to be realistic about the food you are eating. Then time bound, weekly, monthly checks in. So that's why when we give meal plans, we will give you either a 7-day meal plan or a 2 weeks meal plan and the rest of them. What just happened? Uh, More, what just happened? Okay, next slide, please. So these 5 specific nutritional goals are the things that will help you streamline your nutrition and then eat right. Then when we talk about cancer patients, there are key nutrients that helps to support the immunity, helps to reduce inflammation, that boost the body with a lot of antioxidants that will fight off free radicals and the rest of them. Now, when we talk nutrition, we're also talking about nutrients. There are different types of nutrients. I'm sure everybody on this call can relate. When you hear protein, you hear carbohydrates, you hear fats, vitamins, and minerals. So protein, like people say, it is the king of nutrients. Protein plays very major role in cancer treatment. So most of the cancer patients we see, we increase their protein. So we place them on high protein diets. And this is because it helps to repair tissues and support immune system. So when I talked about treatment impact on patients, you're going through chemo. The chemo is targeted towards a cancerous cell. However, it's also affecting the healthy cells. So it's killing the healthy cells. For the healthy cells to regrow, and you are better, you need protein. Protein is the building blocks of life. I mean, it helps in tissue repairs. It helps you, to stay healthy. It helps you to stay strong. And protein also, have uh, the ability to sustain you when you cannot eat. So during those periods when you cannot eat, protein sustains you. Then when we talk about muscle mass, we're talking about people who are losing muscles, not just fat. When someone is slim or someone is uh losing weight, you can shrink your fats and then muscle can be there. But when you do not have muscle, that's when someone is extremely underweight because you've lost fat and you are losing protein. And it's one of the things that happen to cancer patients due to cancer cachexia. It is muscle loss. So make protein your friend. Every time protein needs to be in your food, except you have some renal issues or you have kidney issues. These are reasons why you have to also always consult a dietitian. They will know the amount of protein to adjust, the type of protein you have to eat. But sources of protein are our eggs, fish, legume, poultry, and the rest of them. Protein is all around us. Okay. Then calorie. Calorie is energy for healing. It's not just about healing. I mean, I didn't do justice for putting energy for healing. You need energy to walk, to talk, to relate with people, to think, to do anything. So you're not just eating protein, you're not just eating fruits and vegetables, you have to eat carbohydrates. Someone said, when I asked the question what they've heard about cancer, someone said, I was told not to eat sugar and the rest of them. The truth is, you can't do without sugars. You cannot, you know, that helps to give you the strength you need to continue to strive. Then fluid, very, very important. Fluid. I mean, you have to be hydrated at every point in time. This fluid helps you in the detox system. When you have to remove waste from your body, after the metabolic processes that have happened, waste needs to go off your body. You take in a lot of water. Water is very, very important. And then for a cancer patient, it might be difficult for them taking just water. So why we encourage them to take tea, herbal teas, very, very important. Smoothies, also both, and the rest of them. So, but it's important you continue to take fluid, at least 1 glass to 8 glass of water 8 to 10 glasses of water every day. Or you say 2.5 liters of fluid. Let me not use water, fluid. It could be anything. Okay. And now vitamins and minerals plays key role. I was talking earlier, I mentioned what vitamin C does, vitamin A, vitamin D, zinc, and the rest of them. Um, During my screening sessions and, we're looking at patient biochemical tests, we find out that most times patients who are under treatment begin to lose certain nutrients. I've seen a lot of persons who have very low iron while they are treating, and the rest of them. So what we need to do at that time is to increase, for example, iron giving food. What are the iron giving food? Very simple, vegetables, green leafy vegetables, liver meats and other sources. So you get these vitamins and minerals that helps to support the immune system is strong and then helps you to heal faster. You get it from your fruits, vegetables, and fortified food. What is our fortified food? We're talking about the smoothies now. Your combination can make a whole lot of difference. Next slide. So I'm going to be running really fast here because of my time. So just to mention these practical tips, let's not forget the SMART nutritional goals. Practical tips for eating well. Eat small, frequent meals. Very simple. Eat small, frequent meals. You don't have to uh, put a whole lot of ball of food in your front all the time because the dietitian have asked you to eat. No, eat small, frequent meals. Your meal needs to be frequent. A lot of times when I'm preparing meal plan for my patients, I have to always ensure they eat 5 times a day because cancer demands a lot from you. So your calorie intake should go up, but we have to build it small, small, small. So you start by eating small, especially those who have low appetite. You eat very little food, but it has to be frequent. It's no longer here, it's no longer the case of eat 3 square meal. No, for cancer patients, you don't do 3 square meal. You have to eat 5 square meal, but very small. Okay. Then choose nutrient dense snacks. I've said this before. Your snacking should be a lot different. So I need to also correct something while I say this. Uh, the reason why we want you to snack on healthy, nutrient dense snack is because This snack will help increase the calorie intake and then your recommended calorie allowance for the day. However, you need to also understand that added sugars could be a problem for you. Oh, someone is saying something. Okay. Added sugars. When we talk about snack, I think I should ask this. For anyone on the chat, please, what does snack mean to you, or what do you snack on? So while I'm talking, I'll still waiting to get that response. So snack, what do people snack on? People snack on soda, people snack on pastries, people snack on a whole lot of things. Or for a cancer patient, we are not encouraged. Oh, someone said biscuit and granules. Fantastic. So these are the things you can snack on. Now, it's important we specify the kind of snack a cancer patient needs to take. Number one, chin. That's interesting. I tell my cancer patient, do not snack on pastries or sodas. Someone said meat pie cake. Snack on fruits and nuts. Fruits and nuts. And someone keep asking me why fruits and nuts. Fruits and nuts are, I mean, fruits is going to give you a whole lot of vitamins, and nuts will give you the healthy fats that you need to continue to build your weight, to continue to stay in a healthy way. And when people take, what happens when people take pastries, take sodas, and the rest of them? If you go back to what causes cancer, there have been a lot of questions out there. What actually causes cancer? What are the things to avoid? And people always mention sugars. Sugar does not cause cancer anywhere. I have not come across any book, pastries. I've not come across any book or any medical evaluation to state that, look, sugar causes cancer or sugar feeds cancerous cells. Sugar doesn't do that. Sugar is not your problem. It's not your enemy. When we mean sugar, we mean carbohydrate, we mean starch, we mean all of that. Now, why we advise patients to stay away from sugar is because sugar will predispose you to obesity. And obesity is one of the factors or one of the things that can predispose you to cancer. If you look at what causes cancer, you will hear tobacco smoking, excessive alcohol intake, you will hear obesity, and a whole lot of things. You will hear genetic mutation, it comes from family to family. But obesity plays a major role because when you are obese, there's a lot of cells in the body that might begin to form these things with the help of free radicals binding with them, it becomes cancerous. So obesity is the problem, and it is the reason we advise cancer patients to stay away from pastries. Sugar is not a problem, added sugar is your problem. So when you have added sugars to your food, over time you build fats, over time you become obese. But that does not mean you cannot eat carbohydrate. That does not mean you cannot eat natural sugars. There are two types of sugar, natural sugar and artificial sugar. Natural sugar are the ones that come naturally with food. You have watermelon, very sweet. You have banana and all of that. They contain sugar. They contain fructose. They contain meat as well. Okay. So, and then you have your rice, your semo, all of that. They contain sugar, but they are in their natural form. But now when you begin to go on pastries, for example, I was talking to someone said, I love to eat cake a lot. I said, can you tell me how cake is made? From the beginning to the end, you're adding artificial sugar. That's true. This is not for me to discourage anyone from eating cakes. I mean, once in a while, it's still very okay. But we are saying for cancer patients, these things should stay off your diet list. I don't want to spend so much time here. Maybe during question and answer, I could take more about this. Then staying hydrated, very, very important. Use herbal tea. So particularly about this herbal tea, I mean, people are confused about what actually is herbal tea. What are the healthy teas I need to take? What I advise my patients to do, because I want them to be part of the treatment process, I'll tell them, what are the teas you take? What are the teas you love to take? Could you add this and that? What I recommend is turmeric. People use turmeric for so many things. You use it to cook, you use it to make tea. There's green tea, there's mint tea. And some of these teas also will help in side effect management. For example, change in taste buds, in nausea, you can take your green tea. There is ginger tea, there is garlic tea, a whole lot of them. Oh, I have 5 minutes. I'm going to round this up. So there's a whole lot of healthy teas out there. Maybe I'll take this during question and section answer. Thank you, Mo. Then consider smoothies. Smoothies, very, very important. You have to combine some of these fruits and also add some energy-giving food into it. So I'm not one who tells people when you're doing smoothie, put only fruits and pack it there. No. I mean, is it giving you enough calorie? Is it giving you energy? But what is important is that smoothies are considered healthy for cancer patients. It also helps to stimulate your appetite for those who cannot eat food. When you take smoothie, for example, you have your banana, you have your watermelon, probably you add a little bit of ginger and garlic, and then you add your nuts, almond nuts, cashew nuts, and the rest of them. End of the day, you know, you will have a very healthy smoothie, having all the nutrients that you require. Next slide, please. Uh, Next, okay. So adjusting goals during treatment. I think I've mentioned this. But what is important is that you note that your goals should not be rigid. It has to be flexible. So you are not saying because the dietitian said I should be on 2000 kilocalorie, I have to remain there. While I was talking, I mentioned about speaking with a patient who said my mother's appetite have really increased. So what we do is to adjust the meals. We adjust the calorie intake or we adjust the type of nutrient that is needed. Also, I've been treating, managing a patient who have some level of kidney issues. Here, it's important that we know that while you're dealing with kidney issues, you need to be very careful with your protein intake and the type of protein you're taking. So what we've done is to ensure that we give the adequate amount of protein that will not affect the kidney. Okay, so your goals should not be rigid. It has to be flexible during the treatment process. And it's important also you have to monitor your weight and your energy level. At every point in time you feel weak, you can no longer walk, you can no longer raise your hand, fatigue sets in, and the rest of them. You have to report to your caregivers, report to your doctors, your oncologists, your nurses, most importantly, your dietitian who would tell you what to eat, how you go about it. Weight is very important for us when we're managing cancer patients because we need to monitor how progressive the weight can be. Is it going up or is it dropping? And when this patient keeps losing weight, it's affecting her immunity, is affecting everything. How? Okay. Okay, someone is dropping something, Modi, but I'm sure you take care of that. Then, very, very importantly, cancer patients are seen as top priority patient, I would say. And it's important that they communicate with their healthcare professional at every point in time. Do not take anything for granted. Do not think, oh, I've read this on the social media, I can take care of it from here. No, you have to communicate with your healthcare team every point in time. You're having headache, you report. You're having diarrhea, you report. You're having constipation, you report. Don't keep it to yourself. Don't think because they said it's one of the side effects that will happen. No, you have to report the side effects and seek for the support of your dietitian at every point in time. Next slide, Modube. I think I have to skip some of this slide. Skip the next one because of my time. Okay, great. I've mentioned this collaborating with your care team. So this is one thing I do when I'm seeing a patient at the clinic. One of the things I do is to make them part of that treatment process. How do I do that? If I'm assessing them, say for example, their dietary history, I'm going to ask them questions like, what do you love to eat? What are those things you eat? And what are the things you don't eat? Why don't you eat those? So that way they are becoming part of what we are setting for her. And I'm doing a meal plan. I'm going to consider those food he or she has mentioned to me that is what they love to eat. The only twist to it is that I'm going to look at those food, assess them. The ones that are not good for you, I will tell you, look, this is not good for you. Can we replace this with this? Now that patient says, okay, this is fine. I don't eat beans, but can I eat moi moi? It's a practical example. I'll say, fine. When you eat beans, what happens? You said, I have heartburn and the rest. So that brings me to another question I will ask. Do you have ulcer? What kind of ulcer is it? And we continue to chat. So it's important you collaborate with your care team, collaborate with them work with them. It's not bad when you ask them, what is the goal? Okay, doctor, what's going to go on now? What are you going to do next? What is the next steps to take? So be part of your treatment process. Always share your goals and challenges with them. Adjust plans based on treatment response. Next slide. As I round off, report your side effects. Very, very important. Very important. I will say this not to scare anyone. Let's say, for example, Mr. B has diarrhea and his side effects from chemotherapy or radiotherapy. And this man keeps stooling and probably also vomiting. And at the end of the day, he must have lost a lot of electrolytes. The man falls down, fainted, or something happens. We say the man goes from there. Do you know that something as simple as reporting that diarrhea and vomiting would have saved you? Okay, great. Yeah, someone said eat bread. Fantastic answer. So you could have reported it to your healthcare professional, or you know what to do immediately. But neglecting it will cost you very, very, I mean, it wouldn't be a story we want to listen to. So always report your side effect to your healthcare team, to the nurses, to the doctors, oncology, dietitian, and psychologist. Next, please. So next also. So that of the psychologists I just mentioned is also very important. I mean, people coming into the clinics to ask about what they eat, sometimes they are also very confused. Hearing the news alone that you have cancer can put you off. I mean, you don't know what to do, you don't know where to start from, and the rest of them. It's important you also consult your psychologist because psychologists are part of the team that manages cancer. Then strategies to maintain intake. One might say, how do I maintain intake? I've had things like, I don't know how to make my food. I always eat out and the rest of them. These are very simple strategies, very, very simple. First is stock your freezer petri with favorite food. What are your favorite food? Remove all processed food. Remove all processed food from your fridge. Buy things that are healthy and stock in the fridge. It's that simple. Then cook in advance. Cook in small, small packs, put in your fridge. That way, you wouldn't say at any point in time that, oh, I don't know how to prepare my food or it's going to take me a long time. So small portions will also help you to make your food. Have family and friends with shopping and cooking. This is very important. It could be very difficult for someone who is going through treatment, pains, and all to go for the shopping and the cooking. It's important we also have one friend or one family or family members who would help you in shopping. So I had hoped that on this call, we have family members who are listening and will continue to support their loved ones through this process. Consider prepared food meal delivery services. A lot of times I hear things like I go to work, that's why I can't cook. It's important you identify maybe a good restaurant or a good food vendor who you can relate with. Talk about your meal plans with the person. Ask the person, please, can you be making me food? Deliver to me, I will pay you. These things are not hard. These are strategies that will help you to maintain your intake. Next slide. I think I have 1 or 2 minutes now, Modupe. Uh, I've said this before, try small meals, snack as needed, eat frequently. I've said it no longer 3 square meal, eat frequently as much as you can eat, you know, and eat healthy. Have portion at each meal. Always portion your food. Portion control is key you know. Then pay attention to fluid. I've said it before, fluid is not just water. You can juice your food, you can drink milk. Nobody says milk is bad. Juice, as, especially the one you prepare in your house, smoothies are great. Soup, also fruits. These are ways you can put in fluid into your body. High calorie food, I've mentioned this. Without calories, you can't do anything, and protein is very, very important. Sitting at patient. We need those tissues to repair. So protein plays a major role. So for patients who also are not getting enough protein, we encourage them to take already prepared shakes. Like Ensure, I know I recommend Ensure a lot. There's high protein Ensure drink. There's milkshake. There's smoothies, and the rest of them. But I think I'm rounding up. Yes, I will skip this also. Next, aha. please permit me to talk a little bit about this. This is very important. When you look at some of the factors that could cause cancer, you will note that alcohol is one of them. So it's important you limit your alcohol intake. It's just for one simple reason, oxidative stress. When you keep taking in a lot of alcohol, it's damaging the organs, you know, and your body is not healing. Instead of the body healing, you're giving the body more work. Your liver is doing a whole lot of work trying to take this alcohol off. So I recommend for all my cancer patients not to even indulge in alcohol at all. I mean, limiting could be very fair, but don't take at all at all. Then maintain a healthy body weight. Like I said, we need to take your BMI to check your weight constantly, and we also need to ensure that you are not losing as much weight. Engage in regular exercise, especially for those who have fatigue. One of the things we encourage them to do is exercise, move the muscles, don't stay in one place, don't lie down thinking about the cancer. While you're eating, you're exercising, you're also burning the good, you're also burning fats and then building your muscles. Next, please. Finally, as a roundup, it's important we understand that nutrition is a powerful tool in healing and the management of your cancer throughout your cancer journey. Nutrition is very, very key. You can never neglect nutrition. Set realistic goals, flexible goals. Listen to your body. This is very, very important. I always say this to patients. You can't use what is happening to another person to make decisions about your body or your treatment process. You need to listen to your body. You're having headache, you're reporting. You're having diarrhea, you're reporting. Nausea, you're reporting. Though you have to pay attention to what you're eating, how you react. A lot of times patients say to me, look, when I eat granite, I react in a certain way. Reason why when I'm clacking a patient or I'm assessing a patient, I'll ask about allergies. What are the things you are allergic to? So you need to listen to your body. Make small changes, make a big difference. Thank you very much for listening. I hope I have been able to give answers to some of the questions uh, that is going on through our mind. But I'll take the question and answer section. We'll go over to you.
Thank you so much, Dietitian Charles, for that. Let's please drop some emojis or put in the chat box if you've enjoyed the last few minutes listening to Dietitian Charles. He has shared a lot with us, understanding our body, understanding the importance of nutrition and why it is important, and how exactly are the practical strategies that we can implement so that we eat healthy. This was so beautiful. I mean, see the comments, Dietitian Child. They really enjoyed your session. And I do see that we have a question in the chat, but I would like to encourage us, if you have any question you would like to ask, maybe it has been on your mind throughout this year, you haven't really known who to ask, let's please put in the chat box, what questions do you have after listening to Dietitian Charles? All right. So I see some questions, Dietitian Charles. I'm going to be asking you right away. So he says that the first one is, I just had a mastectomy and I was asked to go for radiotherapy. What nutrition can help with my treatment during treatment and also to maintain my health after treatment? How to manage weight gain while on hormone therapy? So I think these are different questions. Dietitian Charles would love to get your answer to it.
Okay, thank you so much. I think someone also asked that question at the beginning about managing weights, weight gain, weight loss during someone who is on hormonal uh, therapy. So what is important, what we always tell patients when you're on hormonal therapy is you have to work with your dietitian and your doctor. Okay, so first we have to adjust the dosage you are on. You have to adjust, your treatment, the therapy process, and then focus more on eating the right kind of food. What is right kind of food? Is taking food that are high in protein, okay, to build the muscle mass and keep you going. And then we have calories, and particularly we want you to take complex carbohydrates. These are carbohydrates that gives you energy, and in addition to energy, it contains dietary fiber that helps to fight the free radicals, that helps you strengthen your immune system. What are these complex carbohydrates? Your rice, particularly your local rice, um, um, your father rice, and the rest of them, you notice that some of these food, apart from the energy it gives, it contains fiber, oat, Quaker oat. I mean, these are complex carbohydrates and very healthy. And then more still, protein. Protein, I mean, I can't talk about protein enough, but what we concentrate more is on lean protein. Lean protein. So what are the lean protein? Just like the name goes, fat and lean. So it means protein that does not have a lot of fats in it. Typical examples are, your poultry, your turkey, your chicken, and the rest of them. So we are not telling you uh, take all kinds of protein. We want you to concentrate more on lean protein. And then healthy fats. Healthy fat plays a major role. It helps to strengthen the immunity. It also helps to give you a lot of energy. What are your healthy fats? Your avocados, your nuts, all types of nuts. Your almond nuts, preferably your groundnuts, and different kinds of nuts. And then lastly, your fruits and vegetables. These are the ways you need to eat. So these fruits and vegetables are packed with vitamins and minerals that that helps your body, it helps you to fight off free radicals. It helps you to defend your body, and it helps the recovery be faster. I hope I was able to answer that question. So Modupe was the first one. What was the first question? I started from the last one.
Okay, so the first one was I just had a mastectomy and I was asked to go for radiotherapy. What nutrition can help with my treatment during treatment and also to maintain my health after treatment?
Thank you. So
That,
what I have
yes.
just explained to this same person who is on hormonal therapy is exact thing you need to do. So let me reiterate just to mention, we are focusing on four key areas in your nutrition. One, eat complex carbohydrates. Two, feed on lean protein diets. Three is you have to eat a lot of healthy fats. Okay. And then lastly, your fruits and your vegetables. So these are the ways you're going to eat during treatment and as well as after treatment. But what changes here is that you need a dietitian to guide you. You can't do this thing on your own. What dietitian will do is the dietitian is going to assess you nutritionally. We're going to be looking at your clinical signs that you present. We are going to be looking at your anthropometric measurement, which is your weight, your height. That's why you can't do without weight. Weight is very important. We're also going to be looking at the biochemical results as presented. Probably you must have done some tests in the hospital. We are going to be looking at it. We're going to be looking at urea, electrolytes level. We're going to be looking at your protein level. All everything that the lab provides is also very important. The dietitian assesses because a lot of times you see patients come in and their iron level is very low. I keep mentioning this. Most of the patients I have seen who are going through treatment are usually very low in iron. So we look at that and then we look at your dietary history. We ask you questions about your allergies, the things you like, and the things you don't like. So you cannot do it alone. You need to do it with a dietitian who is guiding you. And this same dietitian can help you come up with a personalized meal plan. So me answering you this question, I have told you the basic things you need to do. However, it's important we break it down and those you will get in the meal plan. I can't just tell you eat complex carbohydrate. I will give you examples, I will give you amounts, and we monitor it. That's what you need to do. I hope I've been able to answer that question.
Thank you very much, Dietitian Charles, for that. So I'll be moving on to the next question. So I'm taking two at the same time. So next one is, can we eat bread? And that's the question. Then another one talks about seasoning cubes and herbs, that is curry and thyme. Are they recommended for cancer patients?
Mhm. Okay, thank you, Modube, for that question. It's very, very important we deal with this. I was looking forward to it. Bread. Now, here's the thing, bread is not bad. I say this to everyone. What we want cancer patients or people who are not well to do is to reduce processed food. which bread is one of it, of course. You can reduce bread, or if you can do without bread, this is what I tell my patients, can you do without bread? The person says, yes. I said, fine, remove it entirely. Can you not do without bread? The person says, yes. I said, okay, fine. This is what you're going to do. Every time you're eating bread, you need to incorporate it with fiber or healthy fats. Typical example, instead of using margarine and all of those things for your bread, you can use your the fruit avocado as a paste for your bread. You can use cucumber and all of that. So what we are trying to achieve is to ensure that you're not just taking too much processed food into your body. You have to combine them. Food combination is very key. So to answer you, there's nothing absolutely wrong with bread. The portion is important. If you can do without bread, please remove it. If you cannot do without bread, we'll advise that you reduce it. For someone who takes 6 slices, 10 slices, you can reduce it to 2. So, like I said, sugar is not the problem. The problem is added sugar or artificial sugar. But sugar doesn't cause cancer anywhere. So, nothing wrong with bread. The next question was someone mentioned something on cube, right? Maggie cube and the rest of them. Yeah.
Yes, seasoning cubes
Yeah,
and herbs.
seasoning cubes. Yeah, great. So in my experience as an oncologist dietitian, I will say now is I have noticed that a lot of patients that come in for counseling and are hypertensive. Recently I shared a data that says that over 70% or 60% of the patients that come in or being that are diagnosed of cancer are hypertensive. And I keep asking myself, why? You know, that study needs to be done. But point I'm trying to say is most of them are hypertensive. Now, what do we do when we have a hypertensive patient? Apart from the medications we give you, we want to introduce you to what we call DASH diet. This DASH diet means reducing your sodium intake, increasing your fiber intake. That's what we do. So sodium intake, that's where I'm going with this question. Sodium. Sodium is used as a preservative for most products you see out there. What preserves the food, the reason you can buy food and keep it in your house is because there's a preservative and is made from sodium most of the time. Now, we would tell you to stay away from all of those tube. What we are trying to do is that we are trying to reduce your sodium intake. And you see us tell you also that you need to reduce your salt intake. Now, when people say salt, salt is not the right word is sodium. So sodium is used to make salt. Sodium is used to make Maggi cubes and the rest of them. So what I advise my patient is instead of using the Maggi cube, can you use the natural herbs like turmeric, like ginger, garlic? All of these things can take the place of the Maggi cubes. But honestly, if you have to use Maggi cube, you can go ahead, but you cannot use too much of it. We encourage people, if you can do without it, please do without it. But if you cannot, put very little and you're fine. I hope I've been able to answer that question.
Yes, yes. Thank you very much, Dietitian Charles. Well, for the sake of time, we'll be taking 4 questions, and after that, we'll move on to the next thing on the agenda. So I'll be taking 2 questions, Dietitian Charles. The first is it true that certain food affects the workability of chemotherapy drugs? And the second one is the person would like to know why eating carbs causes severe itching on their surgery sites.
Oh, oh my God, I would have hoped that an oncologist is here to help out because these questions are, really close. The I have not seen this report, in my experience, I have not seen anybody who have reported to me that after eating carbs, they have itching on their chemo site. That question could probably have been taken by an oncologist, but this is what I have to say. Uh, Bad carbs. But I think motivate. What you said something about chemo too. Apart from that, there was. Can you take the question again? This is what I have to say
Yeah,
about.
so yeah, so aside that, so the one that I would say, let me move on to the questions that I think you'll be able to respond to,
No, no.
dietitian Charles.
Okay,
Yes,
go
so
ahead.
what it is that we have some patients, or rather, we have some people on the call who are asking what if they can eat certain things. So some are
Mm.
asking, can they eat goat meat, cow meat, and smoked fish, including yam and snacks? They're also asking about broiler chickens as well as sugarcane.
Good. Thank you, Muzube. So all of these things you've mentioned, there's nothing wrong with it. They are good. Sugarcane. I said this before. I don't know why I keep repeating it. Look, what is sugarcane? It is not. It contains natural sugar, natural sweeteners like fructose and the rest. So there is nothing wrong with eating sugarcane. However, we want you to reduce the intake of your sugar so that you don't become obese. But eating sugarcane does not affect it does not affect the rate at which the cancer cell grows or the rest of them. It does not at all. There's no report or there's no research that have been done to say, look, sugarcane is bad. I have mentioned this here. What is bad is the fact that it predisposes you to obesity. So the concern about sugarcane is the sugar content. I mean, if I could relate. So there's nothing wrong with sugarcane, boiler, chicken, goat meat. It's well, for that we would usually tell people that go there's a lot of there could be some fats in goat meat. So we want you to reduce intake. But for a patient, please, can you
So
mute
sorry
your
about
mic?
that, dietitian Charles. Just give us a minute. Yes, you
Oh,
can go
thank you.
ahead.
Okay, great. So the rest of the things you've mentioned, you mentioned goat meat, chicken, what else?
Yes, I
Modiba, I was
mentioned cow
hoping you
meat.
help me. Yeah, cow meat. Okay, so cow meat, there's nothing wrong with it also, but this is where you pay attention. We talked about lean protein. Lean, that means there shouldn't be fat. So is the trick with cow meat and goat meat. For Yorubas who are here, I will tell them, I mean, if you're going through treatment, it's important you avoid ishoro, the part of the meat that has a lot of fat in it. And it is the issue that is also being raised about goat meat. A lot of times when you cook your goat meat, you see this fat that is coming, that is circulated around it and the rest. So for dietitians, what we frown at is people taking saturated fat. When I was mentioning the healthy fat we can take, we always want to also specify the types of food that contains unsaturated fat and how much you can take. Fat can cause a lot of harm to our body as well. When you have too much of it, people talk about their cholesterol level, the accumulation of fat in the body can be detrimental, can lead to so many things, as stroke, heart failures, and the rest of them. So it's important at this stage that you avoid fattening food, except for the healthy fat. So you have to slow down on the goat's meat. You also have to slow down on the beef that contains fat. But lean meat, which is lean beef also, is okay. There's nothing wrong with it. Uh, but if you permit me, one thing I felt to mention was to mention that, look, when you are eating as a cancer patient, we will encourage you to eat natural food more. That means you have to reduce the frying. You have to reduce all of that. You have to boil your meat instead of frying. Because when you fry food, you're also adding a lot of fat to it. I mean, fat is coming from the oil, and there's a chemical reaction that probably that must have happened. So you're taking a lot of saturated fat, which is not healthy for you. So we prefer you grill your meat or you boil your meat. I hope I've been able to answer that.
Thank you so much for your time, Dietitian Charles. Once again, please let's drop in some emojis. That was amazing. Listen to you answer those questions. And on this note, I would like to hand over to my colleague, Chidubem, to take us on the announcement and the vote of thanks.
Thank you everyone for joining in. Thank you, Dietitian Charles. It was an insightful session. I'm sure we learned a lot of things. Please don't forget to follow us on all our social media platforms, on Instagram at Uncle Paddy app, or LinkedIn at Uncle Paddy Tech. Also, please remember to refer patients for brands. The referral link will be dropped in the group chats. Thank you once again. Have a lovely evening.
Thank you so much, everyone. Thank you so, so much. Do have a lovely day. Please do check out the links in the chat. Thank you. Please take a look at the links in the chat. Follow us on our socials, on Instagram and on LinkedIn. And if you have any woman newly diagnosed with breast cancer who needs free immunohistochemistry testing, you can refer her to the brand program. We'll also drop the referral form link in the chat. If you have any loved one, friend, family, please know that you can reach out to us on brand. Just click on the referral link in the chat box. Thank you so much, everyone, once again. Do have a lovely evening. Thank you.